Good morning. I'm Carlos Fernandez, Policy Analyst at the Vegas Chamber. I'd like to thank you all for tuning to the Confronting COVID-19 Hospital Capacity and Response webinar with several hospital leaders and the Vegas Chamber President and CEO, Maribeth Seawald. Before we get started, I want to take a moment to explain some features of this call. In order to preserve high sound quality, we'll be meeting everyone in the call besides our presenters to make it easier for everyone to hear. If you'd like to ask a question, here's how you can do so. If you're doing this call on the web or through the mobile app, you can ask a question by using the chat feature on the interface. We'll ask your question on your behalf. In order to preserve time, we ask that you please keep questions brief, and we'll be taking all questions at the end of the call. Now, please welcome Vegas Chamber President and CEO, Maribeth Seawald.
Thank you so much, Carlos. Thank you, everybody, for joining us today. And I want to send a special thank you to all of our guests today. We're so happy to have all of you, and I'll introduce you in just a moment, but I want to say hello and thank you to everybody. Thank you again. All right, we are, as I said, very excited to be having our hospital leaders on today as they discuss their individual and collective responses to COVID-19. We know that we're experiencing a new spike in cases, and we'll get to that in just a moment. Before I introduce our panelists, I want to highlight just a couple of things, new chamber programs for you. We'll have a virtual event this Friday at 9 a.m. with Dr. Jesus Jara from CCSD. As many of you probably already know, he is releasing his reopen plan for CCSD, so you're definitely going to want to miss that timely virtual event with us this Friday at 9 a.m. If you haven't already, I also encourage you to stop by the Vegas Chamber offices to pick up your Stay Safe, Stay Open posters, and also your State of Nevada Battle-Born face coverings that the Chamber is making available. Not only to members, but to non-members alike. So if you're a small business and you need face coverings, make sure to go to vegaschamber.com and set an appointment to come and pick up your face coverings. So without any further ado, I want to get to our panel today because we only have about 30 minutes. So I want to make sure that we get their information out and get your questions answered. So we're very honored today to have Mr. Bill Welch with us. He's the president and CEO of the Nevada Hospital Association. We have also with the Nevada Hospital Association, the Executive Director of Community Resilience, Mr. Christopher Lake. Gentlemen, thank you both for joining us. Also with us today is Todd Sklamberg. Todd is the CEO of Sunrise Hospital and Medical Center. Todd, thank you for being with us. And then also, last but certainly not least, Mr. Dan McBride. He's the Chief Medical Officer of Valley Health Systems. Gentlemen, thank you. Thank you all so much for joining us. We appreciate it.
Thank you.
Thank you, Maribeth.
All right, we're going to start it off with Mr. Bill Welch today, the President and CEO of the Nevada Hospital Association. Mr. Welch, you've been on all of the calls just about and more that I've been on, and I appreciate your service. First of all, you're just a wealth of information, and I appreciate your service. We know that we've got reported this morning in the news about 295 new COVID cases, 2 more deaths. Before we started the call, Todd and Chris and Dr. McBride were talking about their numbers. Can you get us started off with where are we today with the cases and how do we stand with the hospitals?
So, yes, Maribeth, we've seen an increase in hospitalizations. However, what's important is looking at it over a trended period of time versus from day to day. You're going to see spikes that fluctuate every day, whether they're up or down. What's key that we look at is how is that utilization impacting our capacity. So we look very closely at what our overall capacity for patients in the hospital. We're looking at our capacity in our intensive care unit. We look at our capacity with our ventilators. And I will tell you that our capacity continues to be strong. We've been averaging going back into the early days of the COVID-19 in the mid 70s as far as utilization of the hospital. And we've been running in the mid 50% range in the intensive care unit area. And right now we're running in the mid to low 20% utilization on our ventilators. The key in that message is we've been able to adjust and respond as the patient utilization has gone up or down so that we could maintain capacity.
Okay, Todd Sklamberg, CEO of Sunrise Hospital and Medical Center, you had some interesting statistics before we started the call, talking about how things are comparing, the numbers are comparing today versus what they were Memorial Day. Can you talk to us about that, please?
Yes, no, absolutely, Mary Beth. And I'm going to try to hold up a chart here in a second, the old-fashioned way, rather than pulling it up on my screen. And what we were showing are hospitalizations, and this is specifically for Sunrise Hospital. Those low points were Memorial Day. And specifically for Sunrise Hospital, we had about 16 inpatients in the hospital of Memorial Day. Today, we have 38 COVID positive patients at the hospital, with another 6 or 7 being evaluated. And that would place us basically at the peak of COVID activity that we saw in March and April. I do want to emphasize something that both Chris and Bill referenced in terms of overall capacity. While those numbers, our COVID numbers, are high, and we're basically seeing a doubling of new COVID patients presenting into our emergency room, over the last week or two. There is sufficient capacity both here at Sunrise as well as in Southern Nevada to handle the increase in population. We are seeing a little less utilization in our intensive care units than we saw in March and April. And part of that also, and maybe Dr. McBride could talk about it, some changes in how we're treating these patients. Much less ventilator utilization than we saw in March and April, where we approached 70 or 75% of ventilator capacity in town. Our ventilator utilization is now in the 30%. So we do have capacity to handle, what we think is going to be a continued upward trend, at least, over the month. And I think, as we always state whenever we talk about COVID, and I know we'll talk about this in a little bit, the most important tool right now is the mask. Okay, mask, and wash your hands. Thank you.
Thank you, Todd. I appreciate that. And yeah, Dr. McBride from Valley, just before we get to the point that Todd was making, I've seen conflicting reports lately about the types of masks or face coverings that are required. Can you clarify that for us, please? What's expected or what works and doesn't?
Sure. I mean, for the general public and for our staff that's not in a patient care area, we only require a cloth face mask, and that's effective in reducing and preventing the spread from yourself to another individual. For our patient care units, we require surgical masks. And one thing I do want to say, the difference between where we were a couple of months ago is our PPE supply. We've been able to catch up with that, I think, substantially. We've got adequate supplies of the N95 masks, the heavier, more heavy-duty masks for inpatient cases and surgical cases. But we certainly we're in better shape than we were about 6 to 8 weeks ago. As Todd said, we're seeing the same kind of thing. Our numbers are increasing, but our actual intensive care unit patients are about half of what they were during the peak. And so some of that has gone to the way we've adapted our treatment protocols. And rather than immediately going to a ventilator for patients that are having respiratory difficulty, we're trying some other non-invasive ventilation techniques, such as what's called a high flow nasal cannula, where you've got a little hood, but you're not actually putting the breathing tube, the endotracheal tube, down. So some of the issues that we saw when we put patients on ventilators, they were very hard to wean off. So, and I also think that what we're seeing is, anecdotally, we're seeing a little bit of younger crowd coming in now. Our numbers, before we had a lot of patients, the elderly patients, we had quite a spike from our nursing homes that we've all read about. We're not seeing that same cohort coming in now. We are seeing some younger folks, the working folks that are being admitted, but generally we're able to discharge a number of these a little bit more quickly than we have been. But like Todd said, our ventilator capacity is robust right now. We've got additional ICU capacity. But we are seeing instead of the decline we saw, we're seeing sort of a V-shaped return to the numbers of actual hospitalized patients that we saw back at the bottom around Memorial Day.
Okay, very good. Thank you, Dr. McBride, for that. Chris Lake, you're the Executive Director of Community Resilience at the Nevada Hospital Association. Talk to us about what's new from your viewpoint.
Well, so from my viewpoint, every single day we survey all of the hospitals throughout the state to find out what their experiences are, and also survey based on their PPE availability. And like both the gentlemen mentioned, we're seeing that the PPE throughout the state has stabilized considerably. So we're not running into those situations where nurses and doctors were seriously worried about whether they would have a mask to wear, and the situations that we heard about in New York that were when they were hitting their spike. So we're in a much better position. The other thing I'd say is, while certain hospitals are seeing an increase in confirmed COVID, in fact, Clark County right now is, I believe, 216 confirmed COVID patients today throughout all the hospitals down there, which is a significant increase. On a statewide basis, we're far from the 700 plus range that we were at back in early April. So we've gained a lot of experience in how to treat these patients, how to the physicians and nurses now have a lot of experience dealing with the patient presentation. They can identify COVID very fast, and I think we have between the PPE situation being in a much healthier spot, as well as the education and the learning experience hands-on that our medical staff now have, we're sitting in a pretty good place with our hospital community right now.
Okay, that's good news. You know, I have a two-part question. This keeps coming up, and we've addressed it a lot, but I want to confirm, because we keep getting the questions, and to clarify about the face coverings. They're meant, who they're meant to protect, the wearer or others? Can anyone speak to that one?
Well, I'll go back to the, again, to the general public. The cloth masks, viruses penetrate through cloth masks. The N95 masks that are worn, the heavier duty, they're kind of difficult to breathe through. They're not very comfortable, but those are the best quote level of protection for the wearer from exposure. But for the public, I think the big issue is to wear the mask to show your concern for your fellow citizens of the state. That if you do cough, if you're breathing, you're going to be able to control the spread of your any particles, but they don't provide protection itself from the virus. But it's important that people wear these, and they wear them appropriately. One of the things that we all see when we go to the store or whatever, we see a lot of patients or a lot of individuals with masks below their nose. That's really not the effective way to wear it. So if you're going to wear it, you got to wear it properly. But I do think that having the public be aware and concerned, and I think it also helps in terms of reminding us of social distancing. If you're wearing the mask, you're a little bit more careful about touching things, about surfaces, and about interacting with other individuals. So I think that that's, as a visual reminder, it's very important.
Okay, thank you, Dr. McBride.
Yeah, and Mary Beth, I think it's also important to go along, with the mask wearing. And here's my level 1 mask, which will protect others from me. Obviously, as we go around the stores and just our daily lives, we're touching, touching surfaces. The key when you take off your mask, be certain to wash your hands. Foam your hands, soap and water, either way. Because the number of times we all touch our face, it's remarkable. So once that mask comes off, we all have the tendency to rub our face where we have the mask lines. That's something we also want to try to avoid.
That's a great point, Todd. Thank you for reminding us about that. For folks who are considering airplane travel, are the cloth masks sufficient, or should those folks be thinking about other types of masks?
I
You know,
would
from
have access to a little bit better mask, surgical grade mask. I would probably wear that rather than a cloth mask on an airplane. If you have an N95, even the industrial kind of N95s are better protection for you if you're actually going to be in a closed confined space.
Yeah, and I think in addition to actually, the airplane, which has, and Dr. McBride will defer to you, but has a strong filtration and air exchange system, it's really when you're also in the airports, okay, touching all the surfaces, walking through the facilities, sitting down, and just be certain when you see folks who are not wearing masks, you may want to just socially distance, from them. I've had some colleagues who flew through Dallas this past weekend, and the mask utilization in the Dallas airport was just a small fraction of what we see here in Las Vegas. So be aware of your surroundings.
Okay. All right. I think it was announced today that Las Vegas hospitals are dropping hydroxychloroquine as a COVID-19 treatment. Is that a fact?
Yeah, that's true. I saw the same thing. So again, when the initial enthusiasm for that medication came out, one of the issues was there was a short supply. And so our hospitals, we had enough. We were treating inpatients with generally a 5-day course, and I think Sunrise was doing the same thing, as was UMC for inpatients. UMC had adequate supplies, and they were giving it to outpatients out of the emergency room as well. They have since stopped that because there has been really no documented evidence that it is effective. And so the downside risk of the medication in terms of heart arrhythmias really outweighs the benefit, I think, for most folks. So that's why it's been discontinued. So none of the hospitals at present will be utilizing this.
Okay. All right. Bill Welch, this question is for you. How is capacity at the rural hospitals, and how is their PPE supply levels?
The capacity at the rural hospitals is doing okay. Keep in mind that most of the rural hospitals are not in a position to have inpatient COVID-19 patients. We only have 4 of our rural hospitals that have ventilators or intensive care unit capabilities. So most patients who present at a rural hospital are evaluated and then transferred to one of our urban hospitals. So we haven't seen a significant impact on increased utilization in our rural hospitals. What I will say about the PPE supplies, and Mr. Lake probably could go into much better detail, is while we're moving back to a normal supply chain process, it's based upon prior year orders. And so your rural hospitals certainly did not go through the PPE supplies like our urban hospitals are. And so as rural hospitals are trying to access the general supply chain, they're finding it difficult because they're reducing your normal order to make sure that they have a balance to supply everybody. So PPE supplies are a little bit more challenging for rural hospitals to access in the capacity levels that they need.
Okay, and I know we kind of already addressed this, but regarding those PPE and surgical masks, do we have enough of those for the average person versus our healthcare professionals? Just to clarify that.
Well, right now, we watch that closely as well, and they are starting to hit the markets, the Amazons and Home Depots carrying them again. So that supply chain is starting to come back online. What is different is the current pricing of those products. We're seeing on average 400 to 600% of a pre-COVID price on those products, whether we're trying to buy them for our hospitals or you go into Home Depot and try to buy them. So the supply and demand curve is in full effect when it comes to mask and PPE at this point in time.
Todd, I see you shaking your head. Do you want to comment on that as well?
Yeah, and obviously when we look at PPE, the first thing that comes into mind, are masks. But from a hospital perspective, we also think about the gowns and the booties and the surgical caps and all the equipment that, that's necessary to take care, of our patients. We have seen pricing, increase as we've all had to use different suppliers than what we've done, traditionally. And just to echo the others, on the panel, I think we're prepared. One of the initial concerns as we entered into COVID was that PPE burn rate, so how much PPE we're using every day. I think we now have, a good couple of months of history, can anticipate the need well, and particularly as we're heading into fall, although it might be 108 degrees outside right now, we're beginning to think about, fall time and when the fall virus season comes back, to be certain that we're well equipped to handle what will come to all of the hospitals ways, at that time.
Well, that's a perfect segue. I mean, that was going to be kind of my next question, and maybe Dr. McBride, you're looking like you want to speak as well. But as the numbers continue to spike, and as we make our way, it's just summertime right now, but as we make our way toward the fall and these other viruses, how much of a concern is that?
Well, I think it is a great concern, and we're all, we've had the opportunity to plan for it a little bit more. One of the benefits I think we have increased capacity for testing. When we were in the middle of the crisis, again, 6-8 weeks ago, we had limited testing capabilities. We really even stopped testing for other viruses, respiratory viruses in the emergency room because it used the same reagents. And so we've had the ability to build back up some supply there. So I think as we move into the new flu season coming on, we're going to have to be able to differentiate flu viruses, other respiratory viruses from COVID cases, rather than only choose one. So we've got a little bit of a head start on that right now. I do want to say that, again, our PPE burn rate, we were very concerned about that. And I want to, we've had the luxury, I think, here with our large hospital systems, particularly, of having very robust supply chain on a national basis that we put everything to work. But I also want to commend and thank the community and a lot of the chamber members, that the facilities and the businesses that stepped up and donated large amounts of supplies to the hospitals, particularly when we were at our shortest. And so that was really a very daily concern for us. Did we have enough supplies for our staff? And we really had to work hard to reassure our staff that their protection was our primary responsibility, because without protecting them, we can't protect the public. So I think I really say I think the hospitals across the Las Vegas community and across the state really stepped up and worked together very strongly, sharing resources, sharing ideas, and certainly sharing, putting sort of market considerations aside to deal with the crisis. So again, we're not comfortable, until we see the numbers go down and flatten out again. But we certainly are, I think, better prepared, and our staff is certainly more comfortable and prepared in dealing with these patients. So that has been a big issue in terms of making sure that our staff feels that the hospitals are doing their best to protect their health and their families.
And Dr. McBride, you talk about an increased capacity for testing, and there's been a lot of talk on the national scene about testing, to test or not to test, and the wisdom around that. I assume all of you recommend that everybody gets tested at least once, if not more.
Well, the testing is, it's a little bit of a double-edged sword there. If you just test randomly, it's a snapshot of that particular day. If you're able to test more robustly for patients that present with symptoms, then you can identify them and then get into contact tracing. So I think one of the benefits that we've seen is the ability to increase our contact tracing. I know the state or the Southern Nevada Health District has ramped that up considerably. So we'll be, I think, in a better position to see where we are in terms of our community spread as we get a few more weeks under our belt with a little bit better contact tracing. I think we have about 250 folks assigned to that now. At the time of the height of the pandemic here, we really had minimal, if negligible, ability to truly do contact tracing.
Okay. And can you all, anyone remind us where we can go to get tested? What are the locations across the state?
I'm sorry, is that for me or for Chris?
For anybody, anybody who wants to chime in, what are the locations where folks can go to get tested across Nevada?
Well, I'll try to chime in, and I don't know the location specific to Clark County, but what I do know the methodology that the health departments are using. In a lot of cases, they are what I would call pop-up testing locations. So they're not a set location with various hours. You have to check where they're going to be. They tend to move them so that they can hit multiple communities throughout the state and throughout the county without people being having to drive too far to go to one central location. So they do pop up all over the place. They try to publish that. You can go to the health department, Southern Nevada Health District's website will have the location that they're currently doing, just as the state websites try to publish all of that information as well.
And I just, Mary Beth, if I can just add one thing about testing. I know a lot of folks are interested in antibody testing to see whether they've had exposure, but again, some cautions about that. Antibody testing is still very unproven. There are a number of different suppliers with different levels of reliability that are out there. And so we really don't know enough about the antibodies now and how long they potentially would last to place much faith in antibody testing at this point. So I think for most folks, it's really not worth the expense if you're concerned about that. But if you do, again, if you have concerns about exposure, the testing capabilities through UNLV, through some of the private clinics, through the large insurance, through Optum, through some of the larger managed care organizations has certainly increased. We're still a little bit hampered in terms of doing rapid testing from the hospital basis. We have, there's still some supply issues in terms of reagents to be able to do that as rapidly as we would like. But most of us are still sending ours out to either Quest or LabCorp with turnaround times of within 36 hours now. So a lot quicker than we were before. So hospitals are not holding on to patients for 3 and 4 and 5 days, waiting for their tests to come back. So the quicker we can identify negative patients, safely discharge them, or identify the positive patients and either discharge them to home quarantine or to admission based on their symptoms is important for the hospitals to keep their capacity levels appropriate.
Okay, and in the about a one minute we have left in our time today, are any of our hospitals involved in research for a vaccine? Does anyone know?
We are currently not. I think several of the hospitals, or most hospitals, actually involved in several clinical trials as it relates to different treatment protocols, looking at plasma and the use of plasma. So we've all participated in some national studies in that regard. Probably just one quick commercial before we leave. One of the unintended consequences of COVID are a number of patients are not comfortable coming into hospitals and have stayed away from the emergency rooms. And we have seen the consequence of folks delaying seeking care, okay? Not going to their primary care physician or an urgent care center or a hospital. So those patients who had some chest pain, who typically would have gone and sought care, thought, let me try to work through it for the next couple or few days, end up in our facilities, okay, having a heart attack or a stroke or other symptoms that could have been addressed much earlier in the course of the disease. So we do want to encourage hospitals, urgent care centers, primary care physicians are safe places. If you need to seek medical care, we urge everybody to do such.
I totally agree with that, Todd.
Todd, that's a great commercial. We certainly don't want anyone thinking that hospitals aren't a safe place to go or ignoring their health issues and concerns, because that just makes things worse. So, all right. Any closing comments here as we wrap up our session today?
I would just like to close with, we're seeing these numbers go up, and so I think it's really incumbent on all of us to keep doing our part, not, sort of give into pandemic fatigue here. We're all tired of this virus, but it is not going to go away on its own. We have to be vigilant. We have to keep the measures up that we've done, and we just, we can't go back to where we were, but we certainly can't ignore the things that we know. And as Todd made the first point about wearing a mask, if you're going to be out in public, please do that to protect your fellow citizens. And just again, don't let your guard down because we're tired of this. We got a long way to go, and we can't get too comfortable with going back to our old ways of and habits.
That is excellent advice, Dr. McBride. I really appreciate that. Todd, did you have a closing remark there? I see you.
No, I'll just stick with the PSA that I gave about seek care if you need care.
Yeah. Okay. All right. Well, once again, Bill Welch and Chris Lake from Nevada Hospital Association, we thank both of you. Todd Sklamberg, CEO of Sunrise Hospital Medical Center, and also Dr. Dan McBride with Valley Health Systems. Gentlemen, we appreciate your service to our community, and we appreciate everything you do for us and our members at the Vegas Chamber. Thank you all so much.
Thank you.
Thank you, Ray.
All right, and thanks everybody for joining us. Don't forget to join us on Friday when we feature Dr. Jesus Jara from the Clark County School District. Thanks again, everybody. Have a great day.
Bye.
Bye.